And now, Wellness Wednesday, brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.
Oh, welcome back. It is Wellness Wednesday, and today we're talking about why rapid tests are so important.
Dr. Jonathan Thierman, president of ExpressCare, back with us for another Wellness Wednesday. Good morning.
Nice to see you.
Yeah, so we're talking about rapid tests and the variety of rapid tests that you can get in urgent care.
Yeah, we do a whole bunch from RSV, flu, COVID, strep throat, and then also urinary tract infections and sexually transmitted diseases.
Okay, so how quickly can patients expect to get test results? How rapid is rapid?
Yeah, they vary. The quickest ones are about 5 minutes, and our newest ones, which are really novel, which is the STD tests, on-site STD testing, takes about 27 minutes.
Oh, wow, okay.
And we're entering that time of year when especially those, RSV, flu, COVID tests are so essential.
Yeah, we're seeing a big spike already. Monday was a very, very busy day for us.
Really?
Wow.
Yeah.
So you're seeing those numbers go up. Are people still confusing now whether they have COVID, whether they have a cold? I mean, how do you even, start to bring people up to speed on remembering what's what?
Yeah, it's really hard even for doctors to figure out exactly. The symptoms overlap a lot. So the best thing you can do is get tested. Some of them have treatments, so you want to know, if it's something that can be treated. Influenza, for example, the flu has a treatment called Tamiflu. But these things don't work unless they're taken very early in the disease. So if you wait 2-3 days, it's already less effective than if you come in and get tested on day 1 or 2.
Got you. And with the rapid STD testing, you were saying you guys are one of the few places that offer that.
Yeah, we have a new PCR-based tabletop test for STDs, and that's pretty novel. Most of the time they're sent out to a third-party lab, and it takes several days to come back. But if you can get the test in 27 minutes, you can get treated right away, slows down the spread of the disease, and it also prevents people from being treated prophylactically without even knowing if they had it. That's the standard of care right now. You treat people even if you don't know it, because you're not going to know for 3 or 4 days. This way you don't get treated unnecessarily, but if you do have it, you get treated right away.
Got
And
it.
you just mentioned too that there are some benefits in knowing earlier, because if you're treated earlier, better result. But again, with those, are they covered by insurance? Do people just come in and do they ask for those, or do you just suggest to them after they come in that you should probably do a rapid test?
Oh, they're covered by insurance,
Okay.
and they're just they're actually less expensive in some cases than the insurance company paying for a third-party testing. So it's kind of a win-win-win all around.
Okay.
Do you deal with a lot of patients who have anxiety about testing, especially the COVID tests?
Yeah, well, there's 2 types of anxiety. One is the test itself. None of the tests I mentioned are blood draws. They're all swabs or samples. So that's that. And then the other part is people don't want to know. But the truth is, it's better to know. Some things can be treated. And, more importantly, also, if you have at-risk people at home, infants, elderly, it's really good to know when it's important to stay away and mask up versus when it's not. So.
Right.
Yeah. And you talked about some of those tests. I always think that, COVID, you were waiting for that 1 line or the 2 line, or, it's like, yeah.
Triggered.
It was exactly, anxiety there.
Yeah.
You said people don't want to know, but how do you just convince people to say, look, if we're just talking to folks now, going into this season, how do you tell people, look, if you just feel like you may have something, what do you?
Yeah, I mean, there's 3 levels. There's 3 answers to that question. On the personal level, a lot of things, there are treatments. So you want to know because you can get treated. The flu was an example of that. Strep throat, of course, you can get treated. The second level is your family and community. It's important to know for them.
Yeah.
And then the third level, we report, ExpressCare reports our findings to the agencies. And so we can, the state can track the trends and see if there's a spike in COVID, a spike in flu, and it helps to know also how the vaccines are working, if they need to, formulate vaccines for the next strain, or if they're actually effective this season. So.
And remind people where they can find an ExpressCare near them.
Yeah, we're up to 35 now. We just opened our latest one 2 weeks ago, and another one's opening in a month. But we're up to 35, and GoExpressCare.com has all the information for where they're at.
Great information as always, Doc, and I guess remember washing hands and all the basic things to do going into the season.
Absolutely, and stay healthy.
All right.
Thank you.
Nice seeing you guys.
Absolutely, same here. And
Wellness Wednesday on WJZ at 9 is brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.